Okay, well, welcome to the encephalitis or encephalitis, depending on where you are in the world. Welcome to the Encephalitis Podcast. In this edition, we're going to be talking about a very difficult topic, death from encephalitis, something which will be sadly and unfortunately familiar to many families and friends whose loved ones have fallen ill from this condition. Death from encephalitis is a topic that we're addressing more and more at Encephalitis International. We came to recognise, as did some of our supporters, that we were perhaps not giving a full and rounded picture of encephalitis and the impact that it can have on individuals and their families. So many of our resources are aimed at helping families navigate the acute stages of encephalitis and its recovery. There was less support available for anyone who'd been left bereaved by the condition. But before I introduce today's guest, I want listeners to know that we do have support available if you find any parts of our conversation distressing. As always, you can find some helpful links in the description in this episode. I now want to welcome my guest, Professor Arun Venkatesan. Arun is Director of the Johns Hopkins Encephalitis Center in Baltimore, where he leads clinical activities and research. He's developed a multidisciplinary program devoted to optimizing the diagnosis of patients with infectious and autoimmune causes and understanding the mechanisms of the disease in order to develop more effective treatments. Arun is a long-time supporter of our work, a member of Encephalitis International's scientific advisory panel, and I can't think of a more qualified person who can talk about this difficult subject. So welcome to the Encephalitis Podcast, Arun.
Thanks so much, Ava. It's really a pleasure to be here.
Well, is there anything, before we start and dive in, is there anything that you'd like to share about your career that I may have missed? I know you're particularly interested in improving diagnosis for people who've been affected by the condition.
Yeah, no, I think that you really encapsulated it, Ava. I have a deep interest in encephalitis at many levels, from the bedside to the bench, and I'm really glad to be here to support your efforts and those of Encephalitis International on this very difficult topic.
Yeah, thank you, Arun. Well, I guess maybe diving straight in, Arun, the obvious question for many is why do people die from encephalitis?
Yeah, well, broadly speaking, death can occur from several different mechanisms. One can be directly related to brain inflammation and the consequences of that in the brain. Alternatively, there can be complications that arise in the rest of the body as a result of the encephalitis. So examples of that, the latter, would include problems with heart function or lung function or development of systemic infections that can be fatal, for example, pneumonias.
You talked about some of those complications. What happens in the brain so devastating during that inflammation that even with supportive treatment and sometimes treatment aimed at the cause, how can death still happen?
Well, encephalitis can affect the brain in a number of different ways. For example, some infections can directly destroy neurons. They can target the nerve cells in the brain. And sometimes this can progress because we really don't have specific treatments for those viruses. When those neurons die, then essentially the central control mechanisms of our bodies have been destroyed, and that's not compatible really with life. Another example is that some infectious and autoimmune processes can be associated with very acute, massive brain swelling. And there's simply not an opportunity for timely intervention, or perhaps it's futile to try to even intervene in those cases.
Is death more often an outcome during the acute stage of the illness rather than during recovery, or can it occur in both?
Well, that's a really good question. I would say that we certainly know more about death occurring during the acute illness that is directly attributable to the acute inflammation. Taking all comers with encephalitis, up to 20% or perhaps more will die during the acute illness, often in the hospital. But one question is how many will die in subsequent months to years? And I would say that the answer to that is not precisely known. It will take a lot of investigation and some careful studies to really address that question. But clearly, there are some encephalitis-related complications that can put people at increased risk for death. Some of those complications include things like decreased mobility, the need for mechanical ventilation, that is supportive ventilation, etc. These things we know from other conditions put people at increased risk for death.
Well, like you, I've been working in this field for quite some time now. And one of the things that has always struck me, and I'm sure it struck you in your career as well, is that sometimes we can often see what appear to be otherwise perfectly fit and healthy young people suddenly die from encephalitis. And I think this is something that their parents and their families really struggle to understand. Why or how can there be such a sudden deterioration, especially in young people, which can lead to death in a very short time?
Yeah, I mean, these can be such just devastating and striking cases. And it's true, we do see this. And I think there are a couple of reasons why young individuals can experience this very rapid deterioration and death. One is, as we get older, our brains actually shrink. That's normal. But young individuals have full brains within this skull cavity. And so if they experience swelling, there's actually not much room for the brain to swell. Paradoxically, as we get older, there's actually more room for the brain to swell and to accommodate the inflammation-related swelling. So I think one reason is that there's simply not as much room for the brain to swell, and that puts younger individuals at increased risk for the complications associated with brain swelling, which certainly can include death. I think there are other potential explanations as well, and we and others are looking at this. Certainly, the immune system changes with aging, and it's possible that the way that the immune system interacts with infections or in the setting of autoimmune conditions may poise some younger individuals to experience more robust inflammation in the acute setting, and perhaps that might then lead to this kind of massive deterioration that can occur.
That's fascinating. And all the times I've been doing this, I hadn't thought about the capacity between the brain and the skull. That's fascinating. You've already touched upon this. The literature tells us that around about 20% of patients affected by an infectious encephalitis might die. And indeed, the literature in autoimmune is perhaps suggesting even higher now. Some papers suggesting up to 40% of autoimmune patients, depending on the cause of their autoimmune encephalitis. But why are mortality or death rates so high in encephalitis?
Yeah, I think the reasons for this are complex. Certainly, we've touched on some of them, which is this is a severe acute process that affects the brain, and that in and of itself connotes some mortality. We talked about how massive brain swelling can occur in these cases, and we don't have great treatments for that. We certainly don't have specific treatments for a number of viruses that can infect the brain. And some of those systemic complications can be very difficult to manage, even when patients are in the intensive care unit and very carefully monitored. For example, if there are changes in heart rate or rhythm, those can sometimes be fatal in these situations. But I think there are other reasons why mortality is particularly high in encephalitis. And I think some of those reasons are related to how challenging of a diagnosis this is. And often there are delays in diagnosis of encephalitis. There are so many conditions that can mimic encephalitis, and sometimes clinicians aren't clued in as to this as a possibility. And we know that delays in diagnosis can lead to delays in treatment, and that delays in treatment can be associated with increased mortality.
Are there any types of encephalitis that are more likely to lead to death?
Yeah, yes, there are. Certainly some viral infections, for example, rabies and related viruses, we don't have specific treatments for, and they just march inexorably through the nervous system to destroy the brain. And in those situations, we're very much limited in terms of what we can do. There are some autoimmune conditions as well that are more likely to lead to death. And one example of that is anti-NMDA receptor encephalitis, which is associated with these very acute changes in blood pressure, in heart rate, in heart rhythm. These severe swings can occur, and that can result in an increased risk of death as well.
often, when I've supported many of these families who have been left bereaved, they often struggle to understand why, even after post-mortem in many cases, they no one can tell them what the cause of the encephalitis was. Why can it be so difficult to determine the cause of an encephalitis?
Well, the causes of encephalitis really are myriad. They span the entire range of infectious and autoimmune conditions, of which we only know, I think, a subset. We're still learning, and we're continually improving on our knowledge, and we're continually understanding new causes of infectious and autoimmune conditions that can cause encephalitis. The testing that we do is continually being updated to reflect our new state of knowledge, but clearly it's imperfect. So I think that's um, one set of answers. Another is related to, what you mentioned about postmortem diagnoses. In some cases, whatever incited the encephalitis has caused the damage and has presumably subsided by the time that a patient dies and their brains are examined. And so, although one can see the footprint of what has happened, the inciting event is no longer present in the brain, and that can make it very difficult to determine the cause.
Is there anything that we can do to address death from encephalitis? Is it as simple as providing better training for healthcare professionals, or what else should we be doing to try and reduce this mortality rate?
Yeah, yeah. Well, I'll try to answer that in a few ways. Of course, training can be helpful so that healthcare professionals can appropriately manage and diagnose encephalitis. From a broader perspective, I think ensuring that healthcare facilities around the world have access to not only knowledge around encephalitis, but to testing and to prevention and treatment modalities. We actually haven't talked about prevention yet, though I suspect we might get to that. And then, of course, I think research is really important. We need to continue to better understand the causes of encephalitis so that we can develop newer treatments that are effective in order to limit death in this awful condition.
Well, you mentioned prevention, and of course, I know that we both have a shared interest in vaccine preventable encephalitis. And of course, one way to prevent death from encephalitis is through vaccination. Can you talk a little bit more about what types of encephalitis can be prevented by taking a vaccine, and any other precautions?
Sure. So we talked about infections and autoimmune conditions as the causes of encephalitis. So when we talk about vaccinations, we're talking about vaccinating against infections. And chiefly, we're talking about vaccinating against viral causes of encephalitis. In fact, the most common cause of infectious encephalitis worldwide is Japanese encephalitis virus. It's endemic in Asia, and it accounts for 5 to 10 times more cases of encephalitis than the next most common cause. So you might imagine that we have an opportunity there to try to limit cases of Japanese encephalitis virus. And indeed, a vaccine's been developed and it's actually quite effective. Another example of a vaccine preventable illness is varicella zoster virus. This is a virus that causes chickenpox. And some of you may be aware that once one contracts chickenpox, the virus actually resides in the body lifelong. And sometimes that virus can get reactivated to cause encephalitis. There's now a very effective vaccine that protects against reactivation of varicella zoster virus.
And I guess another one would be measles. Let's talk about that for a moment. Certainly, we've got outbreaks of measles currently in the UK, and I know that there's some happening across North America and Australia. And I think over the last day or so, I saw reports of outbreaks in Austria. So, let's talk about uptake of vaccines such as the MMR, which is the measles, mumps, and rubella vaccine. They seem to have dropped off globally since the start of COVID for a whole raft of reasons, from vaccine hesitancy to how the medical community's efforts were focused on COVID. How does vaccine uptake look in the United States or in North America at the moment? What's happening around that?
Well, I knew we were going to touch on measles. It's such a hot button issue. And unfortunately, I'm sorry to say that yes, it is a vaccine preventable cause of encephalitis, but for many of the reasons that you just mentioned, those reasons they're very resonant in the USA, and vaccine uptake has dropped off very substantially here as well. So then you might ask, well, what can we do about that? How can we increase knowledge around these vaccine preventable illnesses and increase vaccine uptake? And I think this is a very difficult question to answer. It's very challenging at this moment because, at least in the US, public trust in our healthcare agencies that previously had been quite high has fallen off very dramatically. And I think that really limits our efforts to improve vaccine uptake.
That's interesting. It is a fascinating subject, and I'm sure that we could do a whole other podcast on that. But is there anything, just turning back to families and those that have been left bereaved, is there anything, in your opinion, that can help someone or a family which has been left bereaved?
Yeah, it's such a challenging situation, and I don't think that there's a single answer to that question. I think that perhaps in some cases, an understanding of kind of the stages of grief, denial, anger, bargaining, depression, and acceptance can be helpful. But perhaps that's easier said than done because it's difficult to kind of process through that in the acute setting. Certainly, in many cases, family and social support can be very helpful, and the converse of that, I think isolation can be detrimental. A strong spiritual grounding is probably quite helpful. Time, of course, can be of help, but that's little solace in the immediate period.
Mm. Yeah, it's very difficult. Um, I'm curious as well, the other side of that is how do doctors deal with death and losing a patient?
It's not easy. I think that many of the foundational elements that we just described that can help a family who's lost a loved one will also help physicians. I think it's important to have strong social and family support, and spiritual grounding can be helpful as well. I think physicians have a unique opportunity to share in a confidential manner with their colleagues, and I found that to be quite helpful. I found that some of my physician colleagues are very empathic, and those conversations can really help me to process through some of these difficult periods. Some of my colleagues find that writing or journaling can provide an outlet. So I think there are many different ways. I do think it's absolutely vital to be able to process through these experiences as a physician, really to prevent burnout. And I think it's quite likely that many physicians don't spend the time or the effort to process or reflect enough. And I think we're seeing that physician burnout is really at an all-time high. And I think that perhaps an emphasis on processing and reflection through difficult experiences can be helpful.
Well, those are wise words as we bring this podcast to a close. But as I do that, I want to do what I always do, which is ask you if there was anything that I've not talked about that you would like to talk about, or indeed anything else that you might like to say.
Well, I think we've covered a lot of ground, Ava. I guess maybe I could ask you a question because you've heard so many stories from survivors, from families regarding how severe encephalitis can be, the consequences and the bereavement associated with it, and I wonder how you have kind of processed through these experiences as well.
Oh, well, I think on a personal level, I think I gain a lot from being able to help families that have been left bereaved, whether it's in those very early stages where people are, just completely shell shocked from what's happened, through to in some cases they're helping them in the coroner's courts, or helping them to understand the post-mortem findings that they can share. So I think I'm I think I gain a lot from being able to help people contextualize. You and I both know that there's still a lot of people around the world that don't know about encephalitis. And we do know at Encephalitis International, we do know about encephalitis. So I think we can help people make sense of what has happened, as difficult and as trying as it is. And I've also done a lot around narrative medicine. You touched upon that almost when you were talking about physician burnout and helping people reflect and being able to think about what they've been through. And in many ways, I've done that, through my writings with families that have been left bereaved. Um, so yeah, I think on a personal level, just the knowledge that we have, um, we can't take away the awful grief and hurt that people will experience, but we can help them a little bit make sense of it, I think. And I think that's important. Many of the cases that have stuck with me over the years are those where it was young, fit, healthy people who were dead within 3, 4 days, 5 days, despite the very best efforts of everybody involved in their healthcare, and trying to help a family, parents, make sense of that is something that's incredibly difficult, because I think no parent expects to lose their child during their lifetime.
Yeah, yeah, yeah. Thank you for sharing that.
Well, thank you, because we knew that this would be a difficult podcast to do, but one that we wanted to do because people have so many questions around it. So thank you for taking the time to do this podcast with us, and to be so open and honest about your experiences as well.
It's been my pleasure. Thank you for inviting me.
So, as I mentioned in my introduction, Encephalitis International, or Encephalitis International, has a number of resources that are available to anyone who's been left bereaved by this condition. Our support team are a great resource, which I would highly recommend you take advantage of. So if you've got any questions, or if you simply want to talk to someone, you can contact them. And we also do hold a regular online support group for survivors, family members, caregivers, and also a dedicated online gathering for people who have been left bereaved by the condition. You can find all the information that you need in this podcast description. And as ever, if you can support our work, we would be extremely grateful. You can visit encephalitis or encephalitis.info/donate. But please, if you have listened to this podcast and it has stirred up emotions for you, do reach out to us. Go to encephalitis.info for contact details and to chat online. We are here to help you. Thank you.